Saving Obamacare is not the answer. Single payer is. I'm Tim Black for TBTV. The terms of the healthcare debate must be shifted by Dennis Kucinich. The healthcare debate in America is essentially an argument over what kind of private insurance market people should have access to. President Obama's, where the insurance company made out like bandits, or President Trump's, where insurance companies make out like bandits. Let's change the debate by making it between for-profit insurance versus not-for-profit health care. That's what I and Congressman John Conyers and Jim McDermott sought to do in 2003 when we wrote and introduced Medicare for All, H.R. 676, in the House of Representatives. 6 years ago, I was the last Democrat holdout on Obamacare. My constituents desperately needed coverage for pre-existing conditions and for their adult children. I reluctantly voted for it to prove that some reform was possible, not because it was an acceptable endpoint. It still left out millions and left consumers at the mercy of insurance companies. And everyone knows insurance companies make money by providing as little health care as possible. Insurance companies make money by providing as little insurance or health care as possible. Here's what the for-profit insurance system brings. 1. Rising premiums and copays. 2. Diminishing coverage. 3. More government subsidy of private insurers. 4. Rising costs for prescription drugs. 5. More people going bankrupt because of hospital bills. 6. More people losing their homes because of hospital bills. More seniors forced into poverty, losing everything they worked for their entire lives. This is not about Democrats versus Republicans, liberals versus conservatives, left versus right. This is about life versus death. This is about whether we, as Americans, can recognize a common interest in using the vast resource of our nation to ensure the health of our people. Health spending approaches nearly 18% of the $20 trillion GDP. Nearly $1 trillion of that amount goes for corporate profits, stock options, executive salaries, advertising, marketing, and the cost of paperwork. And we took all the money that people in the government are presently paying into the for-profit system and applied it to care for people. Hell, in a not-for-profit system, we could provide for basic health care for all Americans, including prescription drugs, vision care, dental care, mental health care, and long-term care. But we won't do that, Dennis, because we like free markets better. That is what H.R. 676, Medicare for All, was all about. Medicare for All is an idea whose time has come. Let's make all Americans healthy and wealthy. Let's lift up all our families, save our homes, help our businesses and industries. Let's join every other industrialized nation in the world and offer health care to all our people. The terms of the debate in Washington must be shifted. We must not be stuck between competing for-profit health insurance schemes. Let's renew the debate. Medicare for all, profit for a few. Oh, man, I love it. That's what I'm talking about. Why isn't everyone talking about this? No, why? Huh? Hey, ha. You know why? Because Democrats don't want to offer a real alternative to the crap that the Republicans are throwing up. They just want to, let their side win. No big ideas. Just old, tired, dirty, dumb ideas that help corporations instead of people. That's why. At the end of the day, Dennis Kucinich is right. Forget arguing about Obamacare and arguing about Trump care. Let's argue about, do our politicians really care about us? Because if they did, they'd be fighting to get you some type of coverage that would cover us all. Not some, all. Until they do that, they don't deserve your vote, let alone your respect. I'm Tim Black for TBTV. Subscribe to this channel. Shout out to Dennis Kucinich. That's why they kneecapped him. They did him just like they did Bernie, but worse. Do your history.